Hello, everyone. I'm Dr. David Ajibade with the Brain and Body Foundation, and I'm here with Femi of the Sickle Initiative. Thank you for joining us. So, first thing, Femi, welcome. First thing I want to ask you is, what is
Thank you for having me.
Absolutely. The first question I'll have is, what is it like living with sickle cell disease?
That's a big question. Having sickle cell disease or disorder. The first thing is, in Nigeria, we like to call it disorder, but outside Nigeria, they term it as a disease. So in both ways, having sickle cell disorder is quite challenging, and it affects every area of the patient's life, the health, the academic, the psyche, every part of it, it affects it. And it takes somebody that's very strong and then that is able to withstand the storm to actually survive. It's a continuous challenge having sickle cell. You have to cope with the health, you have to cope with the society, the stigma from the society, you have to cope with the challenges with academics, because academics are also demanding, but having sickle cell does not give room for that. When you're dealing with a disease that is, you can't predict it. It is inconsistent. Today you're fine, tomorrow you don't know what's gonna happen to you. Then it's a big challenge. And the short form is, having sickle cell is a very, very big challenge, and it's not easy.
Oh, fantastic. Well, it seems like you've been able to make lemonade out of lemons, so to speak, by creating a foundation, an initiative, an organization, and they're reaching out and helping a lot of people. I was on your platform recently, and there's a lot of engagement, a lot of interaction. So, how long have you been with the Sickle Initiative, and what's that all about, real quick?
Okay, a lot of people ask me, what does GAIL mean? What does GAIL mean? Where did you get the name from? GAIL is actually a short form of a name, the name Abigail, which is my mom's name. So GAIL means Abigail, is the short form for Abigail. And then what made me conclude to establish a foundation is, I've lived outside Nigeria for some years, and I had the access to good medical care, to standard medical services. But coming back home, I observed that we are lagging in that regard. Our medical services are still substandard. And for people living with sickle cell disorder, what can be done to make life better for them, especially their health care? What can we do to make it better? And so that was part of the reasons why Sickle Initiative was established. And I thought of, okay, since I've been out of the country, I could attract all the professional clinicians, the researchers, and see what we can do together so that life will be better for my fellow winning warriors. I like to call people with sickle cell disease winning warriors, because I know battling with sickle cell is a war, is a continuous war. But I go into every war with the mentality of me winning. And so with that, it helps me cope. Every time I have crisis, I know that yes, this war is coming, but I'm gonna win it, hence the term winning warrior. So that was part of the reason for the establishment of Sickle Initiative.
So it's primarily, and that's fantastic, by the way, I love the whole concept. Is it primarily to educate? What do you exactly do? So you said you bring in experts.
Yes. Primarily really to educate on issues regarding our healthcare. Sickle cell is a very big umbrella, and we have so many challenges under it. In the health area, in sickle cell. We've got leg ulcers, we've got avascular necrosis, we've got acute chest syndrome, we've got gallstones, and so many other challenges. So we have to sit down and discuss this in the Nigerian context. What I observed is that, okay, in Nigeria, a lot of my fellows have leg ulcers. But when you're outside the country, probably because of the weather or the harsh, maybe because we are in the sub-Saharan Africa, but in the Western world, most of my fellows over there, they don't have leg ulcers. So those are some of the issues. I feel, okay, let's discuss it in the Nigerian context and what can we do to make it better. Most of the time, up till now, some of my fellows still go through this pain of leg ulcers, and despite going to the hospital for medical services and all of that, and despite skin grafting, which they call is like a partial cure for it doesn't work for them. I have someone in the organization now. This guy has been in the hospital for years with leg ulcers, and his father is getting really worn out of this. This is getting challenging. The man has had to sell a lot of his properties to see that his son gets the best medical attention. But till now, we still don't have a solution. So those are the things that are really challenging here in Nigeria, and we still don't have the best medical facilities for our health challenge.
Yeah, indeed, it's a really, really, really big challenge, and we tend to forget a lot about the leg ulcers because people just think about the crises and the pain and the faintness, but people don't really talk about leg ulcers as much. So that's a very, very important point. Wow. So tell us a little bit about some of the successes you have had since you started. How long have you had GSI been in existence?
Yes, has just been, I got back, is now up to 2 years. Will be 2 in September.
Oh, wow.
Yeah, wow. And GSI has been, we've been able to deal with the stigmatization, the empowerment channel of sickle cell. What I observed is that for my fellows here, because of the stigma, most of them don't have access to jobs. What do I mean? Okay, when you in Nigeria, when you say you've got sickle cell and you want to go for an interview, most employers are skeptical about employing my fellows. Why? Because, oh, she's got sickle cell. It's not good for my company. It's not cost friendly. It's not cost effective. So most of them just they're just there. So what we did in GSI, we tried to address the public as regards stigmatization. Why are you stigmatizing us? It's not my fault that I have sickle cell. I'm just trying to live with it. So why are you giving me a tag that I didn't create myself? Yes, I've got sickle cell disorder. It's not my fault, but that doesn't mean I'm a demon. I'm not a demon. I'm not a child from the spiritual world that has come to haunt our parents. No, I am me. So you can't stigmatize me. You can't, because of my health condition, not give me a job. Who knows? I might be more intelligent than the normal person that's working there. So why would you, because of my job, restrict me? So that is one of the aspects that we try to address. And then we also, give routine supplements.
Let me jump in real quick because that's a very important point. How do you address it? Is it like a radio, TV? How do you do it? What do you do about
that? There's this thing we do. We call it Sicklepreneur. Sicklepreneur is a channel at Girl Sickle Initiative where we empower our fellows. We train them in skill acquisition. When you train them in skill acquisition, you are empowering them to be independent. Instead of going there looking for jobs, and then you get the job and the employer starts complaining about you, you are sick, I can't afford your hospital bills. Why not just get your own, empower yourself, get your job, be self-sufficient, and then you dictate when you go to work, how you live your life. Not that you're afraid that, okay, I have a presentation tomorrow with my boss, but then crisis comes and I can show up. Do you understand what I'm saying? So through that channel, we have been able to help our fellow winning warriors. We didn't just train them, we also provided tools for this. It's not enough to train them, but it's also by helping them and providing tools for them, you're also making sure that, yes, they are onto this. Apart from that, we also set up, we've been in different webinars and talk live programs where we've discussed the issues relating to stigmatizations severally. In Australia, we were able to talk about stigmatization. Why would you stigmatize me? Am I an Abiku? No, I'm not Abiku because of sickle cell disease. No, I was created like this. It's not my fault. So you can't just stigmatize me. So in ways like that, we've been able to address it. And then we encourage our fellows also, don't be ashamed of yourself. Have confidence. Yes, the world is judging you, but how do you perceive yourself? It is how you perceive yourself. That is what the world interprets and will revert back to you. So we always encourage our people to have a strong perception of themselves. Your self-confidence must be on point, because if you tamper with that, then you can't blame the world the way they see you.